Okay, I think we're going to go ahead and get started now. Welcome to everybody who's joining us tonight. My name is Dr. Chris Montanaro, and we are going to be covering training of elite athletes. And this isn't just for elite athletes. This is for a little bit of everybody. There's plenty of information that will certainly help all different age groups and levels of performance. So relax and enjoy the lecture tonight. Let's jump right in here. First thing to start off with is optimum function. That's exactly what all of us are looking for as far as our health, and certainly when we're on the playing field as athletes. And what I'm trying to do in the office is to bring people to a higher level of health and help them to actually actualize their highest potential. That's what we all want. The aim is to decrease the cumulative noxious stimuli below threshold and allowing the body to heal itself. So optimal function is not just the absence of symptoms or disease. So if you look in the bottom right-hand corner, there's a little chart there that's got health on the bottom, a line, and then there's disease at the top. And I like to show this to a lot of patients sometimes. And basically, if you were to picture health, and if you're at the bottom of health, and every single time you have any type of stress to the body, it could be something physical, pain, you could have something physiologically going on where nutritional issues, or you could have some kind of mental, emotional, different stresses going on. Each one of those add more and more stress to the body, and one stacks upon the other and stacks upon the other until you come closer and closer to that line. And when you cross it, that's ultimately where you're going to experience some type of disease problem, where you've got some type of symptomatology. And it's really important to note that the nervous system controls absolutely everything that happens in the body. And that being the case, only 10% of that nervous system has anything to do whatsoever with experiencing any symptoms or pain, something that you would actually know is going on. The other 90% of your nervous system is taking care of all those other functions in the body that we have no real conscious control over. So something really important to keep in mind, a lot of times people base all of their healthcare decisions based on 10% of the information that's actually going on. And there's certainly many different ways, especially in the office, that we can measure that other 90% to see where everything is at and not just go based on the symptomatology. People would certainly never make moves in the stock market based on 10% of the information, or major life changes financially with their home, with relationships. You would never do that, and so many times people will do that with their health, and certainly with athletics as well, which we'll see as we move on today. So our goals for today, we're going to cover a brief history of my experience with basketball in college and becoming an Ironman. We're going to talk about chiropractic, something called active release technique, applied kinesiology, heart rate variability, cold laser therapy, athletic psychology, and something that everybody's heard about, being in the zone, and their benefits for athletes. We're going to cover several of the highlights that I've learned from being at the Olympic Training Center in Lake Placid, and trying to help us to reach our highest potential as athletes, and then we're going to get into some things on nutrition. First, we've got here a couple of pictures from my first Ironman. I was actually ignorantly stupid when I had done my first Ironman. I went right from chiropractic school, having not worked out a whole lot since I had gotten out of undergrad playing basketball in college. I did a little bit of training, and my first triathlon ever was doing the full Ironman in Lake Placid, which is a 2.5-mile swim, 112-mile bike, and then a 26.2-mile marathon. And certainly that bike course is one of the hardest that are out there. And I finished. It was one of the most incredible experiences of my life, but I probably wouldn't recommend a whole lot of people jump right to that distance. It certainly takes some time. I was definitely humbled, even as a athlete playing basketball at a very good school, and when we did a lot of good things there, endurance athletics was definitely a whole lot different. So we'll continue. Basketball, I played at Catawba College. It's an NCAA Division II school. We won the NCAA tournament. We got there 3 different times. We made it to the Sweet 16 once. We won the South Atlantic Conference Tournament Championship 3 times, and we were 3 times winner of the South Atlantic Conference regular season champions as well. I played with several basketball players who ended up playing professionally over in Europe, and it was just an absolutely incredible experience. Some of the most competitive athletes that I've ever seen as well, and learned quite a bit from them as well. So let's jump into it a little bit here. We'll first cover a little bit about something called active release technique, and this is something that with the doctors who practice active release technique, they're some of the only people that are even at the Ironman competitions treating the athletes, and there's a lot of good reason for that. ART, as it's also known by, is a patented state-of-the-art soft tissue system that treats problems with muscles, tendons, ligaments, fascia, and nerves. So very often treating patients with headaches, back pain, sciatica, plantar fasciitis, knee problems, tennis elbow. Those are just a few of the things that certainly can be resolved quickly and permanently with ART. I've had multiple people who have come in using ART who have had some pretty significant help, both athletes and not. And there's certainly plenty of fun testimonials on the website. Even times where somebody was told by the orthopedic surgeon that they would have to have major knee reconstruction, and it would be a minimum of 8 months before they could even think of running again, and then being able to actually go run a marathon a month later. And I've even had situations where a chiropractor had his wife 13 years prior had been in a car accident and shattered quite a bit of her ankle and foot, and it was pieced together and with pins and the whole 9 yards there. But she had 13-year history of incredible pain in her ankle and foot, to the point where she was very seriously considering amputation. And she showed up in the office and using the active release technique and the cold laser that we'll get into in a little bit. I actually, after that treatment, didn't hear back from her for about 6 months, and I got a phone call saying, "Hey, Dr. Chris, I just slightly starting to feel that pain again. I was wondering if you could work on me again." And I was just blown away. I mean, this is somebody who so seriously was ready to have an amputation at her ankle, and her own husband was a chiropractor. So that's just how powerful active release technique can be. And every ART session is actually a combination of examination and treatment, both at the same time. The ART provider uses his or her hands to evaluate the texture, tightness, and movement of muscles, fascia, tendons, ligaments, and nerves. Abnormal tissues are treated by combining precisely directed tension with very specific patient movements. These treatment protocols, and there's over 500 of them, are unique to ART. They allow providers to identify and correct the specific problems that affect each individual patient. And so ART is not a cookie-cutter approach. Everybody's body is going to be very different, and it certainly takes a lot of skill and practice to be able to distinguish between that. Each course of therapy is individually designed to resolve the patient's problems, and whether you are an office worker, a weekend warrior, or a world-class athlete, the preventative and restorative benefits of ART can help you perform at your best. So performance of any sport by either the amateur athlete or the professional athlete can improve significantly after ART treatments. It's not uncommon after only a few ART sessions to see a considerable improvement in the athlete's best personal performances. ART treatments return the body to a state that lets it perform the tasks that you ask of it when you need it. So Dr. Leahy was its founder and developed ART and had absolutely amazing results, reaching roughly 90% of all of his patients. He attracted the attention of many professional football players. He was hired by 2 NBA teams to treat and consult, and helping several players avoid permanent injury. He worked with the national team swimmers, U.S. weightlifting team, and the treatment at the Ironman triathlons in Hawaii, and now at many of the Ironman competitions, definitely around the country, you'll see the ART providers there. So moving on to the next one, Applied Kinesiology. Sometime I could get into a 5-hour lecture just trying to explain everything that applied kinesiology is, but essentially what it is kind of like a healing martial arts. It really ties the best together of all of your healing disciplines into one system. And this is where I've got my diplomate in applied kinesiology, which makes me one of about 100 specialists in the world in applied kinesiology. Its founder was Dr. George Goodheart, and he was the first chiropractor ever to be on the medical committee for the Olympic team in 1980 at Lake Placid, New York. And you don't necessarily get a position like that without getting incredible results with the athletes, and that's certainly why he was there and why he's one of the biggest names is in the healing arts that there are. So basically using anything and everything to make your body function at its peak without using drugs and surgery, removing as much stress from the body as possible, all the different types of stress that there can be, and allowing your body to be as healthy as possible. This is a really fun slide to take a look at here. This is just a compiled average from 22 medical schools and 11 chiropractic colleges, just to kind of get an idea of some of the classroom hours. And it's certainly not to show that one's way better than another. Just to give you an idea, there's certainly a focus in specific areas when you compare one to the other. But in chiropractic, there's more hours in anatomy. There is, if we go down the list, we've got twice the hours in diagnosis, about 3 times the hour in neurology, more than double the hours in X-ray, and a lot more hours in orthopedics as well. And if you look at total hours, there's certainly, you're looking at almost 400 hours of classroom time more. But whereas we'll spend more time with those side of things, medical doctors will spend a lot more time certainly with things like obstetrics and psychiatry. Microbiology is pretty close. Visceral anatomy, visceral pathology, they'll have some more hours there. So, and the pharmacology and general surgery is really where you're going to see that biggest difference, where we'll spend more time with adjusting, manipulation, advanced radiology, and things of that nature. So it's just kind of fun to compare those, and I kind of broke that up on this slide here. More hours in anatomy, like I said, twice the hours in diagnosis, 3 times the hours in neurology. And that's really important because really when you've got something like the nervous system that controls absolutely everything that takes place in the body, having somebody who's a specialist in the nervous system can be a very big help. 3 times the hour in X-ray and twice the hours in orthopedics. And when you add all that together, that basically would show that a chiropractor is a specialist in nerves, muscles, and bones. And that's exactly what's going to be most important for an athlete to function at their best. So it's definitely a perfect fit there. Next several slides we'll get into some things on the psychological end that can be very important in anything in life, but especially for an athlete. If you fail to plan, then you're planning to fail. Certainly we need to set our goals and plan the roadmap to get where we want to. And if we have no idea where we're heading or what we want, then we're just haphazardly doing workouts in a lot of different directions, and we don't have anything more specific to help us reach what our goals potentially could have been. Have a clear understanding of why you want those goals. We need to have purpose. People without reason or purpose, you come up against some type of adversity and you just kind of drift off in another direction and kind of don't pursue that anymore. Whereas somebody who knows why and they have a definitive purpose behind what they're going to do, you come up to a mountain, you're not going to just stop. You go up over the mountain, you go through it, you find a way to get to ultimately where your goals are. So that can be very powerful. And this is ultimately what gives athletes that psychological edge when you don't want to do that grunt work that makes all the difference between winning and losing, which is one thing that my coach in undergrad had taught us quite often. When we had won so many championships, we would be up at 4:30 in the morning in preseason, lifting in the weight room and running on the track, and everybody absolutely hated it. We were miserable, but it builds a a level of a strength, mental strength in the body. So then when it came to the end of the season and you're more tired and it's time to focus and bear down and be there at your absolute best, we've got some training of our mind to be at our strongest level. So, and it certainly will allow you to train quality at your maximum benefit instead of quantity, which is less than optimum results. So have a very clear focus. What happens to the runner that focuses on all the hurdles? They're certainly going to run into all of them. They hit all of them for sure. And likewise, if you focus on the finish line, you'll get there. The same thing happens when you've got the basketball player at the free throw line, and they're just thinking to themselves, don't miss, don't miss, don't miss. Of course, most of the time they're going to miss in that case, as opposed to Michael Jordan. You know, the team's down by 1 and there's no time left on the clock, and he walks up to that free throw line. You can see it in every way that he's moving, that he just knows it in his mind that it's already going in, and he's got that confidence, and you can see it, versus somebody who looks really kind of timid and scared. They've got a whole different aura about them with their level of confidence. And certainly if you train smarter than your competition, you'll get there before everybody else. It's very important to have vision. Most people are blind. Some people have sight, and very few people have vision. That's one of my favorite quotes that I had heard quite a while ago, and I like that one quite a bit. And certainly dream big and have unshakable confidence in reaching your goals and make it fun. People who are blind will try with all their might to tell you that it can't be done or that you're wasting your time. And a lot of those people have never even had goals of their own, much less achieved them. Those are not the people that you want to be taking your advice from and helping you to reach your goals, especially in the athletic arena. And quite often, as you get closer and closer to your goals, more and more people will try to knock you down. And this is where your careful planning, intense training, and unshakable confidence propel you to the next level. And as you're, say for example, when we're number 1 in the conference in basketball, every single night, all the other teams are coming out and giving you their absolute best. They want to knock off number 1 in any way that they possibly can. And you're going to catch everybody's best shot that way. And really, when you're at that top, sometimes you can get there with some good dedication and training, but to stay there is a whole nother level of mental focus. So people who know and already have done what you want to accomplish, and talk to them and study them and do everything that they do, kind of mirroring exactly what they've done. Have the vision to see what your opponents are going to do and know what you're going to do before you do it. This allows you to control the situation instead of reacting to your opponent's move. And this ultimately comes from repetition. And take a chance. Most people who say they never had a chance simply never took a chance. And remember, especially in athletics, luck is when preparation meets opportunity, and the harder you work, the luckier you become. So also remember that when opportunity knocks, most people complain about the noise. And I've seen this time and time again throughout my life, and most people who I've given this lecture to, or we discuss this, it seems very common among a lot of people's lives as well, is sometimes the things that seem the worst, or the things that you wouldn't want to necessarily have happen in your life, you'll get past that and you learn from it in some way or another, and it actually turns out to be one of the absolute best things that ever could have happened to you. So you continue to drive towards your goals, and every piece of the puzzle that falls in front of you will help you become stronger and get you to where your goals ultimately need to be. And take time to sharpen the saw. There's a great story about a guy. He's sawing away using a dull blade with all of his might for hours and hours and hours, cutting all this wood. And then he has a friend walk by and he says, "Wow, that blade looks pretty dull. Why don't you just sharpen it and you'll get all that work done in half the time?" And the guy says, No, I'm too busy. I'm sawing away here. I'm way too busy to do that." And that happens in just about everything in life. And simple things like this, where we can work on our efficiency or simple skills, could make all the difference in the world, making us faster, running, making us shoot more effectively, just performing all around as an athlete that much better. And certainly the definition of insanity is doing the same thing over and over and expecting different results. This applies to everything in life. So having the same old injuries time and time again or not making any progress on the playing field, take a look at what you're doing. If you're not making progress, then maybe we need to refine it, make things more efficient, and move forward. So as we go on tonight, what we're going to want to do is cover a lot of the benefits an athlete can expect from a great chiropractor. Certainly, we've got things like increased VO2 max, increased reaction time, increased range of motion, increased performance, decreased stress on the body, decreased recovery time, increased immune system, and increased muscular response. Those are some very common things that athletes can see. And 2% makes all the difference. And a great way to illustrate that is actually from Sports Illustrated, where they added up all of the strokes that Jack Nicklaus took versus the number 2 person, and he won when he had gotten close to 100 times the money that the number 2 person had done that particular year. And they added up all the strokes, and they were about 2 strokes difference. And there's a 100-fold increase in the amount of money that somebody had made. And that's how important even 2% can be. If your efficiency running is 2% better, or swimming, bicycling, your shot is 2% better, that can make drastic differences in your statistics and in your times when you're racing or whatever your sport is, seeing things happen more efficiently for you. And even a game that's a blowout, you can almost always trace it back to 5 or so key plays that made the biggest difference in the game. Running, cycling, swimming, usually the difference is fractions of seconds. So 2% better on your training, recovery, treatment, recovery, nutrition, makes the difference between great and coming in second. And the enemy of the great is the good. Nobody wants to be good or second best. And I'll show you many of the tools that will make the difference for you in helping you to reach your goals. So this diagram here is called Yakovlev's model. And if you can see the cursor here, basically if we were to start out at the beginning all the way to the left-hand side, what happens when we work out is we don't actually become stronger right after the workout. We ultimately fatigue the body and it comes down, and then we give it some time to rest, and you'll start through compensation. And if you give it a little bit more time before your next workout, you'll actually go through something called super compensation. That's when ultimately you're a little bit stronger, a little bit faster than you were before you had done that particular workout. And this is what happens when you work out too hard, too often, without recuperating properly. You get sick, you get hurt, and you'll see decreased performance, and you'll ultimately burn out. So what will happen a lot of times is the athlete that's just super excited and they just want to work out like crazy, they'll go ahead and work out, and they beat up their body, and things are breaking down. And before their body is able to heal again, they're already working out, and they're going down even further. And then they're working out again and going down further, and then their times are going down, and they're not really happy about it, so they go work out again because they think that they might not be training enough, and then they keep going down and down and down into a bad downward spiral. And then they're ultimately overtraining to failure, creating such a problem that their immune system is shot, and they a lot of times can be so depleted in their body that it could take almost upwards of a year to be able to recuperate from something like that. And I've seen it happen with several athletes. So ultimately, like what you would like to see happen is you do that workout and you break the body down, you rest, you give it time to super compensate, and you start that process all over again. You break it down and you allow it to super compensate, and then you create this upward trend so that you ultimately you're getting stronger and stronger and stronger, faster and faster in training for success. And then places where somebody like myself can be that much more helpful with the same model here is where when we break things down and we ultimately get to super compensation where we're stronger and faster than before, things that we can do can create something called accelerated recovery so that you can actually recover faster So then you can get that next workout in sooner and work out harder that next time so that you're able to do that and see the benefits as quickly as possible. So how does overtraining happen? Inappropriate recovery methods being utilized that do not keep up with the pace and demands of training. Energy stores of the athlete become more and more depleted, and you've got performance that starts to decrease, and the athletes start rededicating his or her efforts to start training harder. Their points are going down or their times are going down, like we had said, and then they just start working out even harder, thinking that that's what they need to do. And a lot of times that's actually making the problem worse. If they actually gave their body a little bit of rest, they'd perform at a much higher level. And that would just create a problem where it just makes a bad situation even worse. So why does overtraining happen? A lot of times athletes will do too much too soon. They've had a period of off time or some type of sickness or illness, or they just literally haven't been working out and they get too excited and do way too much too soon. They don't have a good plan for working out. They've had complications of illness. They've got that strict adherence to a more is better attitude, a very inflexible training plan, an inappropriate mix of what you should do and shouldn't do. Now, one thing that's really important to think of as well is you're going to lose about 14 days of training when you get drunk. And I bring that up especially when I've given this lecture to a lot of high school teams and college teams. You know, where especially in college, where athletes are open to and have a lot more alcohol around. We've spent all of that time year after year training, and then we do something foolish, getting drunk, and we actually physiologically lose so much. 14 days of training, you think about how grueling sometimes one particular workout can be, and imagine 14 days of that just gone because you just wanted to have one fun night. So just kind of keep that in the back of your mind. And training is kind of like a marathon. It's not a sprint and something that happens overnight. And just like anything in life, they're all processes and not an event. You've never made it. You're always making it. So learn from the past, plan for the future, and live in the present. And take one step at a time. And you don't prepare for a marathon by going out and running 26 miles one day. Maybe you walk around the block, and then you walk around the block twice, and you're slowly adding more and more, and then it turns into a jog, and before you know it, 6, 10, 12 months later, you're running significant distances, and you're doing a marathon, and it just builds on itself. And enjoy that process because it can be a lot of fun. So symptoms of overtraining that people can watch and see where they're at is they can check your heart rate every single morning. You find your baseline and what it is most every morning. And if one particular morning it's a lot higher than the average, then that might be a day where you're going to do more stretching type things, slower workouts. Maybe you'll do some more relaxing type yoga, more restorative and restful type things for the body. If you start seeing attitudinal or motivational changes, if you're just whipped and you're too tired and you're just kind of losing that interest in life or working out and you're just not mentally there for the day, then take a day off and try to recharge the battery. A lot of times what you could do, there's the pH paper that you can urinate on. Your urine is supposed to be acidic, and if you see a basic urine pH in the morning, then that can be a way of seeing overtraining. We talked about heart rate, more specifically 8 to 16 beats per minute increase in your heart rate from laying down to standing up. It would be similar to like a Ragland's test where you take somebody's blood pressure laying down to standing up. It can be significant for people. And if you've got that blah feeling, a lot of times due to electrolyte loss, it's better to have a more calm, relaxed day. You're starting to see decreases in your performance. Make sure you're getting enough rest. And lack of attention to personal hygiene, and that'll happen quite often as well. You kind of start not caring about a lot of things when your body's just beat up and broken down. So a lot of the remedies to overtraining, revisit your training goals and objectives. Make sure that you're on task. Aggressive rest, sleep, checking your diet, and making sure that you're getting the nutrients that you need. Reduce as much of the psychological stresses as possible. Hydrate. using things that we discussed a little bit, the Applied Kinesiology active release technique, cold laser, to really significantly speed up that healing process. That's why they use it in the Tour de France. The U.S. cycling team uses the cold laser every night. That's absolutely grueling for over 20 days riding in the mountains like that. And to be able to recuperate quickly day after day, that's one reason why they use the cold laser like that every night. And certainly visualization and prayer, meditation, all of those things can help reduce psychological stresses as well. Remember, smarter is always going to be better. A well-rested athlete trained at 95% of his potential will always beat an over-prepared athlete trained to 105% of capacity. You always want to train smarter. And even the highest trained athletes can only physically handle 2 maximum capacity workouts per week. And this is where you've got people who every single workout, every single day push their body to their limit, and your body just absolutely can't handle it. And you may argue that you can do that and you can force yourself to for a period of time, but ultimately it'll bite you at some point. Your immune system is slowly decreasing. The stresses on your body are increasing quite a bit, and that's when a lot of times athletes will get towards an end of a season when they need to be at their best. They've got playoffs coming up, their final meets, the most important part of the season, and they're hurt and sick at the end of the season when it's most important. And I've seen that happen with so many athletes, especially at the high school levels, but quite often it'll happen at the college levels as well too. So you should be able to see improvements as follows. Flexibility is something that you can improve every single day. Your flexibility can be better. Strength is something that you should see improving week to week. And if you haven't improved in a particular week and you're following it closely, then we need to look at what's going on. A lot of times that's because you are not recovering properly or you don't have the right nutrition in your body. Speed should be improved on a month-to-month basis, and your endurance ultimately is a year-by-year basis to build that endurance. But that endurance is ultimately what's going to give you that longevity in sport and longevity in life too. That's going to keep your systems running as long as possible. So the enemy of the athlete is something called lactate and cortisol. And if you look at that first top graph here, when we've got workouts and you stagger them, where you start out with an easy workout and then build up to a medium and then build up to a hard, you create that first graph where lactate levels are actually growing at an incline. Whereas if you go to the bottom, where you see you have an easy workout and then a hard one, and then you come back down to a medium and then down even further back to an easy, and then ramp up to a hard again, you create a little bit more of a wave pattern where the lactate levels are going up and down instead of continually going up and up and up and up, and your body has a more difficult time dealing with it. So ultimately you're recuperating better from creating that more of a graph on the bottom where you see easy workout, then a hard one, then medium, and keep alternating in that direction. And how can we change our lactate threshold? Exercise at the lactate threshold level 2 to 3 times per week for about 30 to 40 minutes. Intermittent or sustained workout, and from that switchover point from aerobic to anaerobic, basically plus about 5 to 7 beats per minute is what's going to be the best for training like that. But where most people should be training, especially for endurance sport, is in those aerobic zones. So I'm going to have this PowerPoint and this lecture here recorded. It'll be up on the website within the next week or so. Last week I actually had it up later that night, so I'll get it up as quickly as possible. But essentially, if you follow this basic rule, you take I change this just a little bit from what's written on here. Essentially how this works out ultimately is if you take 180 and subtract your age, what you want to do is not work out over that amount. So let's just say hypothetically you're 50 years old. You take 180 minus 50. You don't go over 130 beats per minute when you're training. And you do your workouts like that, and ultimately your cardiovascular system, your endurance builds significantly. And you can do tests. Philip Maffetone is one of the most well-known people when it comes to training like this. And ultimately what he'll say to do is something called a MAF test. And you can pick, let's say, hypothetically, 3 miles is your test. And you have to stay under 130 beats per minute. Let's just say you pick 125. So you do those 3 miles at 125 beats per minute, and you measure how long it takes you to do that. Let's just say hypothetically you're able to do that, and you're kind of walking a lot, and you can do it 15-minute miles, and ultimately it takes you 45 minutes to do those 3 miles. And then for the next 2 weeks or so, you're still training all of your walks and runs and on your bike or whatever else you're doing. Everything is below 130 beats per minute. And then 2 weeks later, you go back to doing that 3-mile test, and you're doing it at 125 beats a minute, just like you did the first time. But this time, instead of taking you 45 minutes, you finish it in 41 maybe. And you do that week after week, month after month, then you end up being able to do that same exact distance that took you 45 minutes, and you may even do it in 30, 25, 20 minutes, because what you want to do is be able to train harder and harder at a heart rate that stays low so that your body's not working harder than it's supposed to be. And if you're training at way too high of a heart rate, that's where people become overtrained. That's when they're not utilizing the right kind of fuel, and they wonder why they can't lose weight, and why a lot of times, even though they saw gains initially with their what they think is their fitness and in faster times, they really hit a roadblock and a big plateau, and they just can't break through it. Whereas where you train and build an engine that's stronger and stronger and stronger day after day, month after month, year after year, you build this incredibly huge engine that can just last forever. And that's what's going to allow you, especially in endurance sport, but throughout life. If you've built this absolutely massive endurance engine, that's where people can become 90, 100 years old, 110 years old, and they just go about their life doing things that most people look at and they're like, wow, I can't believe you can do all of that. But they've built an engine that can handle it. So really, cortisol is one of the absolute worst enemies of the athlete. Really what it ultimately is going to do is increase inflammation. And cortisol is created during emotional stress, physical stress, chemical, chronic pain, infections, sleep loss, drug use, dehydration, all the different types of stress that we can have increases cortisol levels. And if you look at the graph on the right-hand side here, ultimately what you want to do is keep testosterone as high as possible and cortisol as low as possible. And as your body becomes more stressed, testosterone will lower and cortisol is going to rise, and those are actually going to start approximating each other. And if they keep going closer and closer together, you can oftentimes get to a point where you're done for your season, and maybe even for a year or so, trying to recuperate from overdoing it with your body to that extent. It's really important for fuel for the athlete. The big thing to remember is the way that most people die besides accidents are disease processes that can be avoided with proper nutrition and exercise. Just because you're an athlete and in good shape doesn't mean that you can eat anything you want. You need to actually eat better, or at some point your body won't perform to the level that you want it to. So restoration and regeneration allows the athlete to train harder, recover quicker, improve faster, reach higher optimal peaks, and last longer at that peak. Accelerated recovery. So these are a lot of things that you could do to accelerate recovery from that one model that we had earlier, where we reached super compensation much faster. Breathing that air and actually getting a lot more oxygen in the body. Hydrating properly, watching our diet, increasing our flexibility, getting massaged, going to see a rolfer. Certainly an excellent chiropractor can significantly improve and accelerate your recovery. Cold laser therapy that we talked about, active release technique, applied kinesiology, the proper sleep, posture, affirmations, prayer, meditations. Those are all things that speed up recovery, so then you can get to your next workout as quickly as possible so that you can continue seeing those gains and enjoy that. Hydration is incredibly important. At the point in time when you're thirsty, you've already lost about 25% of your maximum performance. So something to definitely keep in mind. And it's not something that you can start hydrating in the middle of your workout. It's something that needs to be built into a plan of hydrating every single day. Your urine really should be clear. So if your urine is fluorescent yellow because of all the synthetic B vitamins that you're putting in, or just very dark yellow anyway because it's so super concentrated, really it is a good sign of being dehydrated. We really also, especially for endurance athletes and they're sweating quite a bit, you need to replace those electrolytes. And I use a product, especially for Ironman, called Elite. It's basically just your electrolytes put into water so that you don't have a lot of those extra sugars and junk stuff from a lot of the other types of athletic performance drinks, because that can create a lot of issues as well. So Elite, to get into a little bit deeper with that, certainly can increase your performance, endurance, and recovery. It depends a lot on your electrolyte hydration. Electrolyte loss during training and endurance activity is associated with fatigue, cramping, and dehydration. It allows you to monitor your hydration without taxing your digestive systems with all the sugars and the sports drinks, like I had said. And it's really hard on the athletes and their stomachs. So it's also a lot cheaper than sports drinks as well on the market. So and it does a lot better as far as hydration. So something to definitely look at. And you can call and ask and talk to me a little bit more in depth about the Elite. Core training. If athletes were to focus on one thing as far as working out, their core would be by far the most important thing. That's where all of your power and energy should be coming from, is your core. By far. And a weak core leads to sloppy form, injury, and a low level of performance. It's one of the most important parts of the puzzle there. So a great place to start is something like Pilates. This is one of those areas where I've had to cut out a few slides. Just being online like this, I can't demonstrate several different things. But essentially, people start trying to do a lot of sit-ups or crunches, and that's not what our abs are designed to do. We don't push the salt across the table with our abdominal muscles. Our abdominal muscles are meant to be a stabilizer, and in training them with things like Pilates is really important. And also exercises like that, if you were to picture doing a bicep curl, nobody ever works out their bicep muscle and their tricep muscle at the exact same time. They're two totally opposing muscle groups. And by doing a crunch, that ultimately creates that same type of a situation and can create a lot of back pain for people and not ultimately really training the abdominals the way that they need to be. So I can certainly demonstrate those for you in the office, and not a problem there at all. Very important to have joint stabilization. Again, I can't really demonstrate the Blackburn exercises for the shoulders, but a stable shoulder joint is incredibly important for anybody who's throwing anything, a football, a baseball, a basketball, and it can make a huge difference in the way people are able to have accuracy and control of their arms. And another thing to keep in mind, too, is that we've got this arm with a lot of different bones and muscles in the area, but there's only one tiny attachment, bony attachment, for your entire arm to your torso, and it's called your sternoclavicular joint. And everything else, besides that one tiny joint, is held on by the muscles, ligaments, and tendons to stabilize the shoulder. So, training all those muscles, ligaments, and tendons to keep them as strong as possible is going to be able to give you a lot more control and increase the performance there. And as far as for the legs, wobble board exercises and things called proprioceptive exercises for the lower extremity can be really important. And one thing I like people to do, especially when there's a sport that involves a lot of agility, whether it's hockey or basketball, football, is a one-legged squat test. If you can't do a one-legged squat without bobbling all over the place, then your joints aren't stable enough to really be pursuing that sport at that point in time. You're really opening yourself up for a lot of injury. So trying to significantly strengthen those stabilizers will make a big difference in your performance. Even just a little bit of sloppiness in any of those joints, even while you're running and you're not having a lot of agility, if you're losing fractions of a second every single time that your foot's planting down on the ground, that could add up to several minutes, maybe even a half hour to an hour over the course of a really long endurance event. So it really can add up to be quite a bit. So we've discussed, as far as accelerated recovery, the applied kinesiology, active release technique, cold laser therapy. We will be getting into things like nutrition. I also use something called heart rate variability. It's used by a lot of cardiologists and neurologists, measuring the function of the nervous system and the cardiovascular system. I definitely recommend going to my website, wellnesscny.com. There's under services and techniques, one of them is heart rate variability. There's a great write-up and actually an incredible video on there that's only a few minutes long that gets into that. But as we discussed earlier, the nervous system controls everything that happens in the body, and only 10% of that has anything to do with feeling any type of symptoms or pain that you would be able to notice consciously. The other 90% runs all of your organs and systems. And likewise, when we don't want to make our health decisions based on 10% of the information, something like heart rate variability can give us a lot deeper information as far as the deeper function that you don't necessarily feel as some type of ache or pain or symptom in the body. So now we'll move on to nutrition a little bit. If you want to function at your best, you need to certainly put the right fuel into your body. And it's definitely going to be different for different athletes what they need to focus on, whether they're trying to build muscle and weightlifting, an aerobic type athlete, high altitude sports, sports injuries, playing the ball type sports, or endurance sports. A couple of brief things. A couple of these slides are reiterated from the seminar last week on nutrition, but it's just really important to get some of the points across so you understand the difference between something that's whole food versus something that's synthetic. Most supplements on the market these days are highly processed and of little value, if not actually harmful to the body, even with the word natural boldly printed on the label. You can have natural or even organic written on a label, and it can be completely synthetic and very problematic. As long as there's carbon in it, if you remember back to organic chemistry lab, that means that it's organic. So you can write organic on it. What you really are looking for is things that are called certified organic. The problem is that there's so many things to choose from on the market that it's really hard to know what you need and which ones are going to be best for you. So just a really good example of a few different vitamins to understand the difference between synthetic and whole food is that take vitamin C for example. The government's decided to rate it by the amount of ascorbic acid that's there. So companies a lot of times are going to put 500 to 1,000 milligrams of ascorbic acid, but even the doctor who discovered ascorbic acid and got the Nobel Prize for discovering it continued his research and realized he could give as much ascorbic acid to rats with scurvy as he wanted, and it wouldn't cure their scurvy. Ascorbic acid is kind of like, it's the antioxidant portion of the C complex. It's like the shell of an egg. So it wouldn't make sense to give somebody 500 shells of eggs. You'd want to give 500 eggs if you could, where it's got the entirety of everything there to make it function the way that you want it to. So certainly the other portions of that C complex, the P factors, the bioflavonoids, and rutin for vascular integrity, vitamin K, which helps for the coagulation and bleeding, the J factors, which increase the oxygen carrying capacity of the blood, the enzyme tyrosinase, which is an organic copper adrenal activator, which is an incredibly powerful part of that C complex. So there's a lot more to the complex than just ascorbic acid. And a lot of times that ascorbic acid is derived from either petroleum or sugar. Therefore, it contains carbon and it's chemically organic. And certainly can be misleading as well. So even if we tie in a few other vitamins so you can kind of get the idea, there were research studies that were done in the 1990s on vitamin A, which the government makes you on the label put beta-carotene. First of all, there's 65 different carotenes that are all precursors to vitamin A in the body. And what they did was give 10,000 international units of beta-carotene. And what they found was they had to actually stop the study early because it created a several 100% increase in birth defects. So then they said vitamin A is really dangerous and toxic. But if you go to societies where they get upwards of 100,000 international units, but in the form of eating bear livers that are naturally high in that, but the entire complex, they're some of the healthiest people on the planet, and they don't have any history whatsoever of birth defects like that. So it's really important to make sure that we're getting that entire complex. And the same thing happened with vitamin E as well. You'll see research studies, you could pull them up on PubMed, where they showed taking just alpha tocopherol, one of 7 tocopherols for the vitamin E complex, increased problems with heart issues. And likewise, certainly you can see incredible benefits by using things like wheat germ oil that are just naturally high in the E complex without any of those negative side effects. It actually has quite a bit of help for heart-related issues. So big difference between something synthetic, which most everything is, versus something that's whole food. Part of the problem is that people think that more is better, and they're concerned with how well things are functioning, and especially our vitamins. That's what we should be focusing on. People go to the health food store, they label shop, and they'll say, hey, this one's got so many more milligrams than this one, so it has to be better. And that's not necessarily the case, which we had kind of discussed a little bit. So high-potency vitamins are similar to drugs in their effects. They can mask symptoms, and they can force things to happen. And a lot of times people will feel benefits to it for short periods of time, but ultimately over the long run, you're depleting the body of its reserves, because your body still needs to make up the entire complex, and it can leave you in a much worse place later on. So just some common nutritional things for athletes that I'll use quite often. These are all things that I take. The Echinacea Premium. Echinacea itself, there's several different quality levels. A really good Echinacea will make your tongue tingle for about 10 minutes. It is incredibly safe to take every single day of your life, and it actually has a compounding effect that the more frequently you take it and the more often, actually significantly keeps improving and improving your immune system. A lot of people have misinformation about the safety of Echinacea. It's one of the safest herbs that are there, and it absolutely could be used every single day. Rhodiola ginseng complex is a combination of rhodiola and ginseng, obviously, and that can have a great benefit, especially during your hardest workouts or in competition, to give that extra edge and energy for the body. The Eleuthero is a Siberian ginseng. It's a little bit different, which actually helps to build your adaptability. It's called an adaptogen, where it helps your body deal with stresses of working out, or any stresses for that matter, to a higher level. Cardio Plus, about everything that you could think of that's important for the heart is in there. Catalin, by far the most incredible whole food multivitamin that I've ever come across. Anytime that some scientists discover some nutrient and they go back and test Catalin, it's already in there, because of just the most powerful, healthy foods that are just naturally put into that product. The Cataplex B, a whole food B complex, is incredibly important for all of your cognitive and energy functions in the body, so that can be very beneficial. That's often one of the areas, especially where weightlifters, they start not going up in weight with what they're lifting. A lot of times it's a vitamin B deficiency. Fish oil, the Cataplex E2 is the E2 portion is incredibly helpful for increasing oxygen carrying capacity of the blood, and very important for things like high altitude sports or major endurance type events. Myotrophin PMG for rebuilding muscle tissue. Calcium lactate, important. It's a gas for your immune system, and very important for all of your muscle function. Magnesium can help with all of your muscle function as well. Pneumotrophin for the lungs. Drenamin, very important for the adrenal glands, as we said before. The adrenals and the amount of stress that we're under as athletes is very important to pay close attention to, and to support the adrenals can make a big difference for restoring your body and recovering much quicker from your workouts. So things like Drenamin, licorice is very powerful for the adrenals as well. Cyruta Plus for improving that the integrity of your blood vessels. Liver support, Ginkgo can help really getting blood flow to certain areas, especially places like discs and meniscuses that are under a lot of pounding and stress. There's actually, Ginkgo is in a product called Gochu Kola complex, which has the Gochu Kola herb on top of Ginkgo, which is an incredible benefit for healing your muscles, especially healing of the tendons and ligaments and discs and meniscuses, things that have a little bit worse blood supply. Protofood has all 8 of your absolutely essential amino acids, and quite often people, they're getting protein in their diet, but they're missing one really, really important amino acid. From those 8 essential ones, you can make all of the other proteins that your body needs, and sometimes it's just one that's holding everything back. So Protofood has all of them there. Tribulus has been used by Olympic athletes for a long period of time, especially in Hungary originally. Probiotics, 60% of your immune system is in your gut, and a lot of that's because of the good bacteria there. So certainly replacing those good bacteria can help quite a bit, enhancing your immune system so that we stay as healthy as possible and we don't end up at the most important time of our season injured and sick. Digesting our food better with Zypan or Multizyme. Ligaplex for supporting our ligaments. Ferrofood, certainly one of the finest blood builders that I've ever come across. And Vitanox for antioxidant support, several herbs in that particular product. So just some examples, some of the differences, some of the top 5 things for each of these different groups. So for the aerobic group, a little bit more focus for the heart and the adrenals. And a lot of times with aerobics, we're going to be having a lot more repetitive type stress, so really supporting those ligaments as well. High altitude sports, we mentioned that E2, which is going to help the oxygen carrying capacity of the blood. Ferrofood for building the blood and then supporting the adrenals, because high altitude sports are going to be a lot of stress on the body as well. Sports injuries, supporting those ligaments and the muscles, trying to rebuild those as much as possible. And wheat germ oil, very high in the E complex, and also something called octacosanol, which is, if you were to think of something like an anti-gravity factor to help your body deal with the stresses of gravity and the extra pounding, octacosanol is very important there. Ball sports, you're certainly going to have a lot of stress on the ligaments, so Ligaplex and strengthening that vascular support as well. Endurance sports, we've covered some of these as well. Muscle building, focusing more on the proteins, the protofood, and digesting those proteins is very important. Breathing is also very, very important, and a lot of people don't breathe very well. They end up just kind of sniffing the air and not expanding their lungs and getting oxygen in their body, which is going to allow you to just have that much more endurance in life and in sport. So the more efficiently your body can extract oxygen from the air and transfer it to your muscles, the easier your running will be. Heavy breathing triggers a sense of running out of air or passing out or even feeling like you're going to have a heart attack. So breathing is pretty important. Low aerobic capacity, carrying tension in your muscles, eating too much, or they're eating the wrong things, having a really shallow breath. Those all can create a big problem with your health in general, but especially for athletics. I cut a few of the slides here because I can't really demonstrate it as well online, but I do some lifting in the office with a lot of patients that has been incredibly powerful. I lifted all throughout college, a lot in high school. Right before my senior season, my bench press had maxed out at about 315 pounds. Pretty good lifter, but then you get a month into the season and you haven't been lifting as much, and you lose a lot of it very quickly. And you just busted your butt for the last, probably 4, 5, 6 months trying to get up there, and then you lose it so quickly. It's really frustrating. Or a lot of times athletes, they're either showing off of a little bit of an ego in the weight room, or they're doing a little bit too much, more than they should, and going through those very full ranges of motion and not having incredible biomechanics can hurt themselves very easily. And that's certainly not what we want to have as an athlete. That's one of the big differences between somebody who ends up going on to college or even a professional level, is they've been able to eliminate injuries so that they can continue to see improvements and not just have to regress from an injury or being sick, and then just going back to where they were, and then they get hurt and sick again, and that can be a big problem. So isometric and static lifting. I've got a very specific piece of equipment in the office that I use with patients. Just to give an example, it's safety. I use it. I've had people that are in their 70s using it before. One particular woman, in 3 months, her leg press, she's 67 years old, her leg press went from 237 pounds to 600 and over 600 pounds. I don't remember the exact number. I believe it's like 642. So she almost tripled, the minimal doubled, she about tripled her leg press in a 3-month period of time. So tripling your leg strength, it can be really powerful for an athlete, especially even somebody that age. Just that can make all the difference in the world, walking up and down stairs. I had said where I had maxed out my full rep max was about 315 pounds with my bench press. Getting about 3 months into lifting statically, I had got my bench press up to 567 pounds. Massive, massive gains. And that I had never really seen before. It's pretty wild. I originally was turned on to this style of lifting, reading 2 different studies that were done. One was a group of professional power lifters where they would do a full rep max, lift this particular way for 3 months, and then they'll go back to doing a full rep max. And they saw gains of roughly, it was close to 30%, which is almost like a professional going from benching 300 pounds to 400 pounds. In 3 months. That's just absolutely unheard of. Incredible benefits, and they're always from the strongest, safest range of motion, so it's almost impossible to hurt yourself while you're doing it. And these workouts can literally be done within 5 to 10 minutes per week, and you can spend more time on the areas of your sport that are more important, getting those drills in and getting that repetition in. Whether you're shooting extra, thousands of free throws, or you're working on your dribbling drills, or working on improving your foot speed or your biking technique, or whatever it is you really need to focus on more specifically for your particular sport as well. So certainly stop by the office. I can show you a lot of how this works and the equipment that I do that on. And you can read more about it on the website as well. Cross crawl and fascial plans, a little hard for me to demonstrate as well, but cross crawl type exercises. So cross the body, basically meaning like if you're lifting your right arm and your left leg, that's across the body. That just has a way of integrating the body. And there's a lot of different testings in applied kinesiology that I'll use all of the different cross crawl patterns, measuring and seeing which ones are functioning the way that they're supposed to be. And for running purposes, getting into Ironman and starting off with Ironman Lake Placid as my first triathlon that I ever did. I knew that after getting off the bike of 112 miles in the hills, mountains up in Lake Placid, that I wouldn't have a whole lot left in my legs, and I needed to be running as efficiently as possible. And so chi running, evolution running, kind of using both of those. And just to kind of give you an idea, I've got a patient who is an incredibly accomplished runner, and I had kind of mentioned both of these things and wasn't quite sure how he would take it. And he certainly watched both of them and was able to integrate things from both of them and learning quite a bit. So even somebody who is an incredibly accomplished athlete as a runner, making changes in your efficiency and your biomechanics with running can make a really big difference in saving you injuries, decreasing your times, and just making it a lot more fun while you're out there doing your sport of choice. And ultimately what chi running is focusing on is using that chi, that inner energy, but it's focused in that core, which I was saying earlier is so important for an athlete to focus on. I can demonstrate that for you as well when you come in the office. Definitely recommend reading the book, and there's a DVD on it so you can see, and they've got workshops where several-day workshops where they show people all the different techniques with chi running, but can be very important and very helpful. They've got both chi running and chi walking, which can make both of those things a lot easier and more fun for a lot of people. The zone and mental grounding. Everyone wants to be in the zone, and if you've been around in your sport for long enough, you most likely have felt it at some point. And this is that basketball player that feels like the rim is as big as the ocean, and anything you throw up is going in, and it's an absolutely incredible feeling. And you can create that feeling and mental edge whenever you need it. You can bring it up and be in that zone. You can train yourself that way. And one of the most important ways of doing that is by drilling the fundamentals. John Wooden won more championships than anyone simply by drilling the fundamentals. You take somebody like Grandmaster Jun Rhee, had the exact same approach. Anyone reaching a black belt basically has to master 7 moves, he would say. And the key is not always learning new and crazy things. The key is, however, to master the fundamentals. And as boring as they can get, it's the difference between making it to the next level or not. So, a lot of times you'll get people that, they want to learn something new, and then now they want to learn something even newer than that, and they keep adding all these things, and they've never really mastered what they learned before. What we want to do to get into that zone is that you've had so much repetition, and it's so ingrained in your body that you never have to think about it again. It just happens instinctively. And that's incredibly important. A great movie that brings that to light. Remember in Top Gun when the instructor is kind of giving Maverick a hard time. He's like, "What were you thinking up there?" He said, "You don't. When you think, you're dead. You can't let your body, your mind get in the way. You react instinctively, and it just happens because you've done it so much." And that's ultimately what the best athletes in the world are doing. They don't think about it. It's not broken down into a million pieces and very arduous process. It just seems to happen and flow easily. But you only get to that point through incredible repetition. Biomechanics, posture, and gait, certainly very important, and a lot of things that we can work on in the office. Can be assessed by somebody with a very trained eye. You can uncover areas of the body not working as efficiently as they should be or could be. And definitely remember that 2% we were talking about earlier. Being even 2% better with your posture will pay you back exponentially. And finding imbalances is vitally important. Some muscles may not be firing at all, while others may be constricted with scar tissue and adhesions from injury and repetitive stress. And all of these things are draining energy from the body and keeping you from a maximum performance. Make sure that you've got the proper equipment. Wearing clothing and socks that will wick the sweat away from your body. It'll prevent chafing, keeping blisters away, especially for your endurance sports. Keep your skin will breathe easier and keep you cooler and hydrated longer. And definitely don't go cheap when it comes to the right equipment, whether it's shoes, balls, bikes, whatever it is. It definitely will pay you back exponentially as well, making sure you've got the right equipment, that it's safe, and you're going to be effective being able to use it and make it a much more enjoyable process. And protect yourself. Protect your ankles especially with those ball-type sports, football, basketball, hockey. You really want to make sure that you're protecting yourself. You've got the right kind of supports and braces. In college, I never played without having my ankle braces on. You twist an ankle, and you could be, without rehabbing it properly, you could be several weeks that you're not functioning at your best, maybe not even playing, which definitely doesn't help, especially at the wrong times of the season. And I go through McDavid USA for a lot of different braces, but there's several different ones that I'll use in the office from a lot of different companies, so we can discuss that on an individual basis as well. And this is definitely important across the board, but since I've given this lecture to a lot of high school and college athletes, I specifically put it in there for that purpose. Act like a professional in everything that you do and say. Remember about your goals and have the end in mind. That vision that you have of yourself at your best carries with it the responsibility to act like a champion every single day. And you're not a human being. You're a human being, not a human doing. What you are doing is not who you are. Think who you want to be when you want to grow up instead of what you want to be. That mind frame will prepare you for a successful future in life and in sport. And as always, do the impossible. I believe that humans were born to do two things: make mistakes and do the impossible. And certainly the more you do of one, the more you'll do of the other. It's not about being perfect every single time out there. Making mistakes and learning from them is the name of the game. You'll do that through all areas of your life and see big gains because of it. If you can have the mindset to learn from them and let it propel you forward instead of paralyzing you and holding you back. And I'd like to thank everybody for joining me tonight. It was definitely a little bit more of a watered-down version of this particular seminar because of some constraints, being able to show some things and getting into more depth in person and demonstration purposes. But it should give you a good baseline of information to get started from. Ask any questions in the office. I can demonstrate all of those things for you there as well, and that'll be an excellent situation. So I wish you the absolute best in all of your athletic endeavors, and I welcome you to come to the website wellnesscny.com. There's tons and tons of different videos on there that get more into depth on all the different services and techniques in the office. I'll have a growing library of all of these webinars that are going to be saved on there that you'll be able to watch. Last week's is on there, all about nutrition. My phone number's there. You're welcome to call the office anytime, email me, go to the website, ask any questions. Certainly, that's my life's passion, is to help people function at their absolute best, whether it's on the health side with all the different types of symptoms and diseases that people have, or just athletes trying to absolutely be at their peak. So anything in any way that I could be of help, I'm definitely more than willing and very happy to do so. So thank you very much for joining me, and I will look forward to seeing you in the office.